Hello, it's Dr. Rob again, and welcome to installment number 2 of my 1-minute wellness videos. So today I would like to give you a tip that you can utilize for every single chiropractic adjustment that you have at our office. And the tip is, when you come into the room and fob in and open up your chart, go ahead and lay down on my chiropractic table and wait for me. Rather than sitting in the chair, when you're sitting and you're upright, gravity is bearing down on your spine and your postural muscles are always working. But if you go ahead and lay down on my table before I come in, it'll give your back a minute or so to relax, and then it'll make my job easier when I'm doing your adjustment, and we could probably get even better realignment. So in our office, it's not rude or it's not awkward to go ahead and lay down first. My favorite way to greet you is with you laying down on the table. And so if you can go ahead and do that, that would be amazing. It will help you out at every single appointment. And also what I'd like to talk about today is the different stages of care of your corrective care program. So in the beginning, we have more the symptomatic stage. This is where patients really want to see their symptoms lessen and resolve, and we tend to do our adjustments a little more frequently. So going twice a week, once a week. And we tend to, the symptomatic stage usually lasts anywhere from about 2 weeks to 2 months. And we find most of our patients will see significant symptomatic improvement in that window of 2 weeks to 2 months. And then after that, your spine is still vulnerable and not as stable as we want it to be. So the next stage of care is the stabilization phase. And at that phase of care, usually you're going about once a week or once every 2 weeks. You're feeling better, but you're still vulnerable that if we discontinue your treatment and you miss a few appointments, you'll start to notice that the symptoms will come back. And so we're getting better, but we're just not stable yet. And that phase can take about 5 months to really get under control. And that's when we like to do our first update x-ray. About the 5-month mark, we should be able to x-ray your spine and see at the very worst that it's not getting worse, and we hope to see some corrective changes coming in at that point. After we have your spine stabilized, then we're in the corrective mode of your spine, and that's going for appointments every 2 weeks. If you're not receiving care at least every 2-week mark, we're probably not getting enough momentum to make corrective changes in your spine. And so we keep going at every 2 weeks until we see as much correction as we hope to see or that we can achieve on your x-rays. And that time frame can take a year, it can take 2 years, depending on how much damage there is in your spine, how well your spine is reacting to care, how stressful your life is on your body outside of our office. And so there's many different factors. But we do our progress exams about every 3 months, and some of them have x-rays, some of them don't, but we'll always do tests to make sure you're progressing. And eventually we'll get to a point where I'll say, you are as corrected as we can get you, and now it's up to you whether you want to maintain what you've achieved and do wellness care. We have a lot of patients that come into our clinic, and they're like lifetime wellness patients. They've had amazing results, they felt the effects on their body, and they don't want to let what they've achieved undo over time. And so they decided that they'd like to continue on and do proactive tune-ups and just get the most out of what we are doing. And that's usually about every 2-week appointments to every 3-week appointments. We've had patients attempt every 4-week appointments, but one thing that concerns me with that is that for a lot of patients, their x-rays slowly continue to degenerate and get worse when we do every 4-week appointments. So now you're getting a good understanding of how the care program is working. Right now we're in the symptomatic phase, and we're going to get you to the stabilization phase as quickly as possible, and we hope you're enjoying your care. And if you have any questions about this video or how your care is going, don't be shy to ask me at your next appointment. And when I come into the room, I hope to see you laying down on the table, letting your back relax so you're all ready for your adjustment. Take care, have a great day.